tired of knee pain? Guess what? It may not always be your knees. It may be your glutes. So let's fix that with 3 main resistant band exercises that can help your knees. I'm Dr. Patrick Figueiredo from Physical Therapy and Balance Centers here in Harker Heights. And I'm here to tell you that the knee pain not always is because of knee trouble. So what we've been seeing here with tons of patients from running to squatting trouble, we've been getting some very, very weak hips, right? So a lot of poor mechanics in there. So a lot of times patients ask, but why are we doing a lot of hip exercises? My knee is in trouble. So what we see is the glutes are one of your biggest muscles in your lower extremity, right? So if they are not able to absorb the load when you are running, so every step you run, you're pretty much jumping from one leg to the other. And if the glutes are not very strong to be able to absorb those loads, the loads have to be going downstream, right? For your knees, for your ankles, for your foot. And a lot of the times that will increase the capacity of the knee can handle and will be reproducing as pain. So one of the most common injuries will be runner's knee, IT band syndrome, patella tracking issues. All that might be causing from a weak hip that's not able to stabilize and absorb those forces. So one of the common things that we'll be finding is weaknesses on the glutes, like when we are looking from a strength perspective. So a lot of the times runners, they love running, right? So they just go for runs and runs and runs. So they do not necessarily do strength training, or they do any strength training that is recommended for a side-to-side movement, which is the stabilizers of the hips. So we're gonna go over through a few hip exercises with these pure bands. So, and it can be for any level, right? Orange if you're just starting, it's an easy. The blue one is the medium level and green is the heavy. I really like this band, and once we start changing to them, we can see a lot of benefits. Definitely different material that I recommend. They are small enough whenever the legs get close together, the bands are not falling, they do not roll up. So I highly recommend this because instead of buying over and over and over bands, this one lasts for a while. So you can hold it for months and years in front of you, so you can get a long longevity for the bands as well. So I really like the bands. So we'll get you here the resistance, the medium one. The first exercise I want you to know, it's going to be a stability of the hips. So we're gonna go all the way here to the knees, placing the bands on your knees. We're gonna get into a side plank position, right? And then on this side, there'll be 2 motions. You're going to lift your hip like you're doing a modified side plank, and you're gonna go to a clam. So we're gonna be working on both hips at the same time. I usually like to hold this for 5 seconds and then go all the way down. And then you're gonna repeat holding up so you feel the burn going, and then back down. So variations, you can stay here and just move while the other one stabilizes, right? But the most one that I really do a lot here in clinic is the both kind of stability. So hold 5 seconds and then go back down. We'll do 10 times and then we'll switch to the other side. So making sure you're doing both sides as well. So using the band, holding 5 seconds on top, and just from these 5 seconds here on the 2, I'm already feeling that burn in here, right? And we're using the blue band here, which is the medium one. So I would start with that. It's more of a stability work. Once you're done with that one, I would like for you to go all the way down to your ankles, right? And we're gonna do more dynamic motions. So knees slightly bent, and we can go from side to side And here we're gonna do a lot of feeling on those hip muscles, right? You're really gonna see it burns. So you can take a few steps one way, a few steps the other, rest as needed, slightly bend, and then continue to do this version of it, okay? And then last exercise is a combination. Now we're mainly going forward and backwards. So same positions of the bands all the way on your above your ankles, and we're going to close, open, and very all the way up forward. Once we get forward, we'll do the same motion going backwards. So you are englobing the whole 360 of your hips, forward and backwards, right? So it will look like going forward towards you, open and close, and then coming back towards you. And just by doing this little 3 repetitions in here, my hips are burning. We do a lot of those here in the clinic to get patients to prime and optimize their glutes, to be able to give a little bit better support and allowing you to do better when you go out for that run. Okay? Hope you helped. If you like the content, please click on thumbs up in here, subscribe for more PT talk, and I'll see you in the next video.